Democrats unveiled their new Medicare-for-all act last week, proposing just that, free medical care for all American citizens, paid for by the U.S. government. And in this crowded field of social justice issues dominating the political arena, healthcare may turn out to be the true economic issue to emerge for the Democrats in the 2020 race for the White House. Joining me now, Washington Examiner's Kelly Jane Torrance. Kelly, what's the GOP alternative to this?
Well, that's a good question, Charles, and this is something that they really need to start thinking about. It kind of reminds me of the bit of a debacle with Obamacare. The Republicans had campaigned for, 8 years saying that they would get rid of Obamacare, and in all that time, they did not come together on a plan to really fix the problems in the healthcare system and offer a replacement. And that's one of the reasons we never saw the repeal of Obamacare, is that the Republicans didn't quite have their act together in having something to replace it. Now, of course, the U.S. healthcare system is one of the best in the world, and I'm from Canada originally. I can tell you from experience the American system is superior, but there's no question there are some problems, and Obamacare tried to deal with some of those, did a terrible job, I think, but there are problems, and Republicans have to face that fact and get together and do something, because we're hearing a lot of talk, as you know, about Medicare for all from a lot of the 2020 Democratic presidential contenders.
And the reason for that is because it was the top-ranking issue in the midterm election. So, listen, we both know you can be against something and it can resonate and it can actually carry you to victory, political victory. But at some point, too, when you have a chance to be in charge, people are going to ask. And I'm just kind of concerned that it's not going to be enough to say, hey, this Medicare for all is outlandish. It upsets what everyone likes, because, in fact, most people do appreciate their doctor. Most people do appreciate the healthcare system that their employers are providing for them. And to your point, there are folks who need help, but not enough to disrupt this whole thing. But I think at some point they better come up with a plan.
No, you're right, Charles, and it's amazing that they didn't learn anything from the Obamacare disaster. You think, and a lot of think tanks around Washington here have come up with various ideas, various plans, but no one in the Republican Party has really gotten people together to coalesce around any of these ideas. And of course, I think a lot of the best ideas involve giving people more choice. For example, getting rid of those barriers that make it impossible for people to buy health care across state lines.
Right.
I mean, while you have Democrats complaining and wanting to get rid of private insurance, of course, that it's private health insurance that's paying for Medicare and Medicaid. Doctors and hospitals actually take a loss on those. They're paid by the private patients. So the fact that Democrats want to get rid of that, the Republicans should really be getting, attacking them on that, but showing that, hey, you know what, we can actually use the parts of the healthcare system that are working well and expand that and give people more choice, more options.
No doubt about it. I mean, and to me, that's like the lowest hanging fruit of it all. It's a slam dunk. Kelly Jane, thank you very much. Great seeing you.
Thanks, Charles.